Good afternoon, everyone. Thank you for being here. Today, I'll provide an update on the West Royalty School outbreak and also some of the national epidemiology and also changes related to travel and testing. Today, there are 2 new cases to report of COVID-19 in P.E.I. One is a close household contact of a previously announced case related to the West Royalty Elementary School outbreak, which means this person has been self-isolating. The other individual is in their 50s with a history of recent travel outside of Atlantic Canada, and contact tracing is underway. We do have 1 public exposure notification as well, and that is at Boston Pizza, 700 University Avenue in Charlottetown, Saturday, September 25th, between 12:30 and 1:15 p.m. We currently have 9 active cases and 296 cases since the pandemic began, and that's 19 months ago, and it's hard to believe it's been 19 months. Since August, 87% of the cases in P.E.I. have been identified as the Delta variant. And certainly across the country in the last week of reporting, 98% of the cases have been the Delta variant. To date, there are 30 cases linked to the outbreak at the West Royalty Elementary School. 9 are children under the age of 10 years, 15 are between the ages of 10 and 19 years, and 6 cases are adults who are household contacts of the children. Over 340 individuals were identified as close contacts of the positive cases linked to this outbreak. A special thanks to the students, parents, families, and staff impacted by this outbreak, especially those required to self-isolate. Your cooperation and that of the community allowed public health to do its work and to get this outbreak under control as quickly as possible. In the last week, the number of new cases was down 5% across Canada, while hospitalizations were up 12%, ICU admissions up 7%, and COVID-related deaths up 25%. In Atlantic Canada, cases continue to rise with 860 new cases in this past week and 1,027 active cases in the region. The latest modeling from the Public Health Agency of Canada predicts we will continue to see a resurgence and spread of the Delta variant well into the fall. The national modeling also suggests that a 25% reduction in contact rates, along with high vaccine coverage, will really be together what we need to help from a herd protection point of view against this very transmissible Delta variant and to keep this 4th wave under control. This time last year, we were 200 days into the pandemic and had reported a total of 58 cases in P.E.I. In comparison, we've had 63 cases in the month of September this year. Last year, all our cases were linked to travel outside the province, and all were the original strain of COVID-19. An approved vaccine was on the horizon, and we were not even talking about variants of concern at that time. Last year, we were observing the impacts of the first wave of COVID-19, and we could not have imagined that 1 year later we would be managing a 4th and the nation's worst wave, driven by a very aggressive and transmissible Delta variant. It is troubling to hear about the rise in hospitalizations and ICU admissions in other provinces. Health systems are under severe strain to care for the people who are critically ill, and elective and non-emergent procedures being impacted. The situation in some jurisdictions is serious. We will continue to do everything we can to protect our healthcare system here from being overburdened with COVID-19. And when we say this, it means that we want to make sure there's capacity in the ICU and in P.E.I. hospitals to care not only for COVID-19 patients, but to care for your partner, your mother, your loved one, if they have an accident or require hospital care. In P.E.I., we remain focused on our game plan to limit importation of the virus and to contain community spread when we have cases of COVID-19. So we will continue to use the tools at our disposal, the P.E.I. pass, screening and testing at the points of entry, isolation and follow-up with people who are not vaccinated. When we have cases, we will continue to rely on the foundations of public health infection control, testing, contact tracing, isolation, and follow-up. On Saturday, September 25th, a public advisory was issued asking P.E.I. residents to carefully consider travel outside of P.E.I. at this time and to avoid non-essential travel. This advice was based on the rising number of cases in the Atlantic Canada area and also in the rest of the country. Now is not the time for discretionary travel. As a reminder, currently we have the following travel-related testing and isolation measures in place. Anyone arriving in P.E.I. from outside Atlantic Canada, we are testing at the airport or 2 people per vehicle at the points of entry, even if they are fully vaccinated. Those who are not fully vaccinated are required to isolate and be tested. For people arriving from within Canada, we have been testing those who are not vaccinated, and those who have not had at least 1 dose of vaccine are required to self-isolate and be tested. Effective last week, regardless of vaccine status, we increased testing for people coming to P.E.I. from New Brunswick and children under the age of 12 years of age who are not yet eligible to be vaccinated. Today, as additional protection for the residents and visitors of our province, by September 30th, we are taking steps to enhance our testing even further at the points of entry. We will be testing everyone who enters P.E.I. regardless of vaccine status, including P.E.I. residents returning home. School-aged children who cannot be tested will be given a self-test kit at the point of entry to ensure they have a negative test prior to returning to school. There may be some testing exceptions for P.E.I. residents who do same-day travel. And beginning today, and for at least the next couple of weeks, individuals over the age of 12 years who travel to P.E.I. from any destination, including P.E.I. residents, regardless of their vaccine status, I'm recommending as well they be tested at least once after they arrive between days 4 and 8. And of course, if they develop symptoms of COVID-19, they should be tested immediately. So I'll repeat that, effective immediately and at least for the next couple of weeks. Individuals over the age of 12 years of age who travel to P.E.I. from any destination, including P.E.I. residents, regardless of their vaccine status, we are recommending that they be tested at least once after they arrive between the days 4 and 8. And if they develop any symptoms of COVID-19, they should be tested immediately. So for example, if you return to P.E.I. from whether it's New Brunswick, Alberta, or any other province, territory, or country on this past weekend, even if you were tested at the points of entry, it is recommended that you be tested at one of our health P.E.I. clinics between day 4 and 8, which would really be sometime middle to the end of this week. Additionally, school-aged children under 12 years of age who are returning to P.E.I. are asked to be tested on day 4 and 8. School-aged children will require a negative test prior to returning to school after travel. And if they have any symptoms of COVID-19, they should be tested as soon as possible at one of the health P.E.I. testing clinics. Given the increased testing at points of entry, people should expect delays, especially at Borden. Staff will do their best to do their work as efficiently as possible. However, delays will be inevitable. At the Confederation Bridge, in order to facilitate the safe and smooth flow of traffic, there will be dedicated lanes for P.E.I. residents and high-sided vehicles. We ask that travelers please be patient and to build extra time into your travel schedule in the event there is a delay. Previously, P.E.I. passes were issued to people within Atlantic Canada who had a single dose of vaccine. Given the high rate of fully vaccinated people in the Atlantic region and the importance of being fully vaccinated to protect yourself and others from the Delta variant, going forward, P.E.I. passes will only be issued to individuals who demonstrate proof of being fully vaccinated plus 14 days. For the thousands of people who already have a P.E.I. pass based on 1 dose of vaccine, and these are P.E.I. pass number, and they end with an A. There is no need to update your pass. However, if you travel off island, you should have a copy of your vaccine record to prove you are fully vaccinated. And also, please check the vaccine requirements for wherever you are going in other jurisdictions. Effective September 30th, individuals who travel to P.E.I. from within Atlantic Canada, as well as outside Atlantic Canada, who have 1 dose of vaccine and who are considered partially vaccinated will also be required to self-isolate for 8 days with a negative test on day 8. Our team continues to meet, review the evidence and our epidemiology, and talk about what we are doing and what else we can do to protect Islanders from the Delta variant, and importantly, to protect our healthcare system and to protect Islanders. We certainly talk about some of the measures we already have in place. Our Vaccinate or Test program, whereby frontline staff who are not fully vaccinated and are working with individuals who cannot be vaccinated or are vulnerable to severe outcomes from COVID-19 will be tested regularly in the workplace. And we've talked about it before, but for example, staff in schools, early learning centers, group homes, residential programs, correctional facilities who are not fully vaccinated will be tested up to 3 times per week. And this requirement came into effect on Friday, September 24th, and complements a previous order that requires staff in long-term care and community care who are not fully vaccinated to undergo regular testing. P.E.I. families in rural P.E.I., where there's limited access to COVID-19 testing, have been picking up the Lucira self-test kits at Access P.E.I. sites in Montague, Surrey, O'Leary, Alberton, and Tignish. As of yesterday, over 3,000 kits have been distributed to families. These kits are being made available to parents and guardians to test their children who have symptoms of COVID-19 prior to going to school, childcare, or other activities. We are also maintaining our capacity to do follow-up with individuals required to isolate after travel, meaning they are not fully vaccinated. And currently, there are less than 100 households in isolation related to travel. In addition, we have capacity to conduct testing, contact tracing, and to do regular follow-up with our close contacts who are required to isolate. We are continuing to administer the COVID-19 vaccine, and our vaccine rates are really tremendous. As of Saturday, September 25th, 93.6% of eligible island residents have had at least 1 dose, and 86.2% are fully vaccinated. And we need as many eligible island residents to be fully vaccinated, of course, as soon as possible. If you are eligible to be vaccinated and have not had 1 or both doses, please drop into a vaccine clinic or a local participating pharmacy to get immunized. If you know someone who is hesitant to be immunized against COVID-19, and if you're comfortable, reach out to support and help them, maybe offer to go to the clinic or pharmacy with them to get immunized. We have excellent COVID-19 testing capacity, including point of entry and point of care testing. We are continuing to stress the basic public health measures such as gathering limits, physical distancing, frequent cleaning and disinfection, hand sanitization, and staying home when not feeling well. In addition, masks are required to be worn in indoor public places. Government is implementing the P.E.I. Vax Pass as a means of verifying vaccine status for P.E.I. residents and visitors to access certain services, events, and businesses. Public health measures such as cohorting, masking, and gathering limits will remain in place. However, physical distancing will not be required within cohorts at events where everyone is fully vaccinated. And I know there will be more information from the government in terms of the Vax Pass in the near future. I do expect that frontline staff at businesses where there is going to be a P.E.I. Vax Pass, that they be treated with kindness and respect. I have been asked many times when this pandemic will be over. And believe me, I'm as anxious to know the answer to this question as everybody else. And I think we all wish we knew the answer with certainty. And someone said, could you shine off your crystal ball and let us know? What I do know is I think the next couple of months, as we get through this fourth wave, will be a challenge. And in order to put COVID-19 behind us, I do think we need to have our children vaccinated. And at this point, there's no vaccine approved for use in youth under the age of 12 years. Until that happens, it's important that as many eligible Islanders as possible roll up our sleeves and be vaccinated. And we do all these things we've just talked about in terms of layers of measures to keep us all healthy and safe. As P.E.I. and other jurisdictions struggle to manage the Delta variant and the fourth wave of this pandemic, we need to take steps to protect Islanders, especially those who are most vulnerable to severe COVID-19 outcomes and our healthcare system. The changes announced today in relation to testing at points of entry, testing after arriving in P.E.I., and requiring those entering P.E.I. who are not fully vaccinated to isolate for 8 days are steps that will continue to help us limit importation, detect cases early, and contain the transmission of COVID-19. And as much as we all want to get back to normal, travel, activities, spontaneous gatherings, and not to worry about COVID-19 restrictions and whether people are vaccinated, we have to remember that we might be done with COVID-19, but it is not done with us. This last mile with the global pandemic is longer and more challenging than we could have imagined. As we have seen during the last month, similar to other jurisdictions, COVID continues to be a threat to P.E.I. So as we continue our journey through COVID-19 together, let us continue to be patient and continue to be kind. Thank you. And I'll open it up to questions. I'll start with either one of you.
Okay, I'll go first, if I may.
Okay,
It's
sure.
Brian Higgins, CBC News. Now, if I understood what I heard correctly, Dr. Morrison, starting today, it's recommended that everyone entering P.E.I. age 12 and up be tested on day 4 and 8. Did I hear that right?
That everyone coming in will be tested once between the days 4 and 8. So at least once between that day 4 and day 8. So, and that's whether, regardless of where you're coming from, whether you're coming from one of our neighboring provinces or further away. And that is a recommendation, but the testing on arrival starting September 30th will be a requirement.
Why is the testing between day and 4 or 8 a recommendation only? It sounds like there's wiggle room that, given the severity of it, maybe that wiggle room is not ideal.
Well, I mean, I think we're testing people who are vaccinated and unvaccinated. Those who are unvaccinated are going to be in isolation, so they're going to be tested regardless. And we know that there's a certain incubation period, tends to be around 5 or 6 days most commonly, and so that's why that period of time. And of course, symptoms, anyone with symptoms at any point in time should be tested. We have to look at our testing capacity and how many people are coming in at the points of entry. I think, and partly we're doing the testing of vaccinated individuals because we know that they, if people are vaccinated, it lowers the risk of them having COVID, but with the Delta variant especially, they may still be carrying the virus and may transmit it to others. So that's why we want to check. So now, in terms of children who are less than 12, we are asking them to be tested twice, I guess 3 times total, at the point of entry and on day 4 and on day 8. So for children less than 12 who are unvaccinated, they'll be tested the 3 times.
Hi, Dave Stewart from The Guardian. Dr. Morrison, thank you so much for taking our questions today, as always. I've heard you speak about the increased screening and testing for island residents as of September 30th. What about residents from Nova Scotia or New Brunswick who are coming into the province, regardless of whether it's for a weekend or for a longer stay? What additional measures are they being faced with?
Well, they will be tested on the point of arrival starting September 30th, and that's something that we haven't been testing someone coming from Nova Scotia, for instance, but they will be tested on the point of arrival, and if they're going to be here for longer than 4 to 8 days, we would expect them to be tested while they're here. For instance, if they come for a week, we'd want them retested as well.
And long term, what are you hoping to get out of these restrictions, we are facing Thanksgiving is normally a time of a lot of travel in the region with families going back and forth. Are you hoping to be able to ease these travel restrictions the second week of October, or?
Well, I mean, in terms of the travel restrictions, I guess what we're talking about is more testing. I mean, so we haven't put any other requirements from a travel restriction point of view, but certainly more testing. But we have said when we see the cases going up so much in other provinces, really whether or not some consideration about whether or not you really need to travel. And I think that's what we've said. I think we'll continue to look at that. And people have to travel sometimes to support families. Sometimes they need to travel for work. I mean, there are many reasons people do need to travel. And if they do, they need to be, fully vaccinated. They will get tested on when they get back here and again after they get back. Masks in indoor places. And a lot of these measures are somewhat similar in the other jurisdictions too. So it's very important to follow their public health measures in whatever jurisdiction people travel to.
To speak, I guess, on the modeling, what does the immediate future look like as you know what the numbers look like right now?
Yeah, so when I spoke about some of the national modeling, and the fourth wave, according to the modeling, looks bigger and higher than we've had in our other waves as a country. And what they have looked at from a modeling point of view is if we can reduce our contacts by 25%, if we can try to make sure people are vaccinated as much as possible, which P.E.I has done a really good job at, we may be able to reduce the height of that fourth wave. And also what we're hoping to do is also decrease the length of time that fourth wave lasts in the region and of course in the country. So those are the things that we're looking at, but I'm hoping it will improve, but I think the next couple months, according to the modeling, certainly make us concerned.
Where are we with the LND outbreak at LM Montgomery School? I'm assuming you wouldn't say that it's over or contained or?
So yeah, so the West, I think you mean the West Royalty. Yeah.
Sorry,
so no,
I
I thought you were.
apologize.
I just worried about that there was another one, but so we definitely think it's really under control. We've not had identified any new cases that are not already in isolation in, I think, over a week now. So that's very reassuring from an outbreak point of view. But according to the definition, the outbreak will be declared over when at least 14 days have passed with no evidence of ongoing transmission, meaning that there are no new cases linked to the outbreak for at least 14 days. So it's going to be really 14 days before we would be able to declare that over.
That's great. Thank you very much for your time.
You're welcome.
That 14-day mark would be reached at this point on what date?
October 10th.
Okay. Okay. And on the weekend, we heard about one more case that was under investigation. Any more information to share with the public on that?
So there was, we announced a case on, I believe on Saturday, that was identified an individual in their 20s. And we did confirm it was an individual at the post-secondary institution at UPEI. And the close contacts have all been identified and are in isolation and being tested appropriately. And I think, there's not been any link to travel that we can determine. So, or certainly at this point in time. So that's always a concern. But we've spoken about it last week. Is there a certain degree of community transmission? Certainly, there's no evidence of widespread community transmission, but it remains a concern because we are not able to link the case on the weekend to directly to travel.
Regarding travel, you're advising islanders not to leave the island, and yet we continue to allow people from outside the province to enter the island. Has thought been given to closing the borders again to non-islanders?
I think we have to be careful. We're not letting people leave. If people still may leave when they, and as I mentioned to Dave, they may leave for all sorts of different reasons. But when they come back, there's certainly the recommendations of testing and being vaccinated. And I mean, I think it'll be interesting to see what happens with our neighboring provinces as well as their cases increase. I think there's probably less travel back and forth now than there would have been in the middle of the summer, just with tourism. So we know the numbers are not as high. And I mean, I think those are the reasons we want to test as many people coming across our points of entry as we can, and to test them after they've been here a few days, regardless of vaccination status, regardless of symptoms, and to see if we can minimize any kind of spread here.
Is there any additional information about the Vax Pass starting October 5th that you can share with us? Will it be a paper at first before the phone app?
Yes, and so I think I'm probably not the lead person to speak to this about, but because there's a group of people who are really working really hard to make sure that all those operational details are looked after. And I think you may have heard that there's some of the consultation with businesses that started yesterday, and there are a number of other consultations happening in the next couple of days with various groups and organizations. My understanding is that it will start with a paper-based record, and then move later in October to the QR code. And so I think for many reasons it's probably important that islanders and island residents download their vaccine record, and all those kind of details will be certainly made available to everyone. There may be, I don't know if there's anyone on the line or not. I'm getting a nod, there is.
Yes, good day, Dr. Morrison. You mentioned the case from the weekend that it was someone at a post-secondary institution, and we've certainly heard lots of concern over the last couple of days from students and staff at U.P.E.I. about that case. So can you tell us, was it a U.P.E.I. student? And I guess, you know, what's been the impact at the university? Do you have students and staff that are in isolation, and why wasn't there a public exposure notice for U.P.E.I. if that was the case?
Hi, Steve. So I think I've just, confirmed to Brian it's an individual at U.P.E.I. Who was identified as a case. And this is very, every case we deal with, there's a very standard kind of contact tracing protocol that's used basically here and all over the country. We interview the case, we identify close contacts and casual contacts. They're tested and isolated as appropriate depending on risk. And with all of these situations, whether it's an individual in any business organization or at the post-secondary institution, there'd be questions about does the individual live at the university? Does the person eat in the cafeteria at the university? What type of other contacts did they have with staff and students? But we do that whether it's a case, how did they get somewhere in terms of public transport? So all those questions go in and to our decisions. But the administration was notified immediately of at the university regarding the case, and we don't, of course, tell the administration at the university any personal information about the case, but we certainly work with the administration to identify, help identify any other close contacts that we might need help identifying names and contact information for. it's a pretty standard approach that we use, and we've done this, I don't know, almost 300 times, and 63 times in the last month. So I think there was the individual at the university did not have public exposure in terms of, for instance, if it was a student, they weren't in the cafeteria or with a whole bunch of classes or places where individual close contacts could not be clearly identified and easily identified.
Sum it all up then, I guess if there are students and staff at UPEI that are worried, what's the level of risk here?
I think the level of risk is very low, and those who are identified as close contacts are in isolation and being tested, and that number is actually quite relatively small. And but as we have said right along, if anyone has any symptoms, they need to go get tested, and they shouldn't wait just until there's a testing clinic. Once a week, they should find another place to be tested. So I think that's what we have, and we've been in communication certainly with the administration since Saturday about some of that direction at the university.
The fact that UPEI does have rules around vaccination, and if staff and students aren't vaccinated, they'll still be required to get tested, does that change your thoughts around a case coming out of UPEI or your level of concern?
I mean, not at this point, because that policy hasn't been fully implemented yet, and there was a time period for that. So that is not something that we were considering at this point in time. I think we're certainly asking all the close contacts if they're vaccinated or not vaccinated, because it determines their testing regimen and their isolation requirements.
Okay, thanks so much.
You're welcome.
Michael Bahar, The Guardian.
Good afternoon, Dr. Morrison. I've got a couple questions around the Vax Pass, so I'll fire them off and you answer what you can, I suppose. So first, I'm just sort of wondering, it's a week away. I'm sure that there are plenty of staff at these restaurants who are concerned over, potential abuse that they'll have to face. You mentioned in the briefing people should be kind and whatnot, but what recourse will those staff have for those who refuse to comply?
Well, I mean, I think what you're talking about is really the enforcement of the Vax Pass, and the first part will be, from my perspective, certainly education of the public, and and importance for businesses also with education for their staff. We know that in Prince Edward Island, we talked about the high rate of vaccination that we have here. So I think we expect that this will be, for many people, something that makes them feel more comfortable about participating in certain venue or at certain venues or in certain activities. But any other sort of more details on the enforcement, I think, will be addressed later in the week.
Perfect. And then I'm curious too, sort of, if patrons are required to, I'm just using restaurants as my specific example, but if patrons are required to have a Vax Pass, will we see either a Vax Pass requirement for staff in those restaurants, or will we maybe see something like the vaccine or test policy that's rolled out this week?
Certainly, my understanding from the Vax Pass at this point in time, it applies to those who are frequenting, the public who are attending events, and the requirements for staff will be really up to employers, how they want to implement or require vaccination or a vaccinate or test policy. That will be up to the employers.
Perfect. And you mentioned the more info coming out later this week, so should we expect another briefing to sort of go over what this Vax Pass will look like come next Tuesday?
I'm not sure if it'll be in a briefing or release format. I'm not sure.
Perfect.
Not
Thanks so much.
not that I don't love coming out here, but I'm not sure. And it'll
Thanks so much.
involve other people in government. And I know the premier is busy today, but I imagine he'll also be involved.
Gabrielle Drummond, Radio Canada.
Bonjour, Dr. Morrison. Alors, est-ce que vous pouvez, s'il vous plaît, nous parler qu'est-ce qu'il change en français, s'il vous plaît, qu'est-ce qu'il change dans les frontières de l'île à compter d'aujourd'hui et aussi à compter du 30 septembre? Est-ce que vous pouvez nous dire quels sont les changements aux frontières?
Bonjour, Gabrielle. Alors, vraiment, on augmente les tests au point d'entrée aux frontières à l'île du Prince-Édouard. Et puis, c'est pour les insulaires et les visiteurs à l'île. Alors, on veut faire tester les gens qui entrent à l'île du Prince-Édouard. Et n'importe... ça fait rien s'ils viennent d'Alberta, Nouveau-Brunswick, n'importe où. On veut faire un test au point d'entrée. Puis ça va commencer le 30. Mais même depuis maintenant, on veut que n'importe qui vient d'entrer à l'île du Prince-Édouard ou qui vont entrer ici à l'île du Prince-Édouard, même s'ils ont un test au point d'entrée, il a un autre test entre les jours de 4 à 8 après qu'il retourne ici à l'île du Prince-Édouard. Alors, s'il vient de retourner à l'île du Prince-Édouard la fin de semaine, demain, jeudi, il doit être testé encore. Et puis, pour les jeunes qui sont moins de 12 ans, on veut qu'ils soient testés. Vraiment, les gens entre 8 à 11 ans vont être testés au point d'entrée. Et puis, les plus petits qui sont à l'école vont être donnés un test. Et alors, c'est un point d'entrée, un test à point d'entrée, et puis un autre test, 2 autres tests à jour 4 et à jour 8 pour les jeunes qui ne sont pas vaccinés. Et puis, c'est tout pour essayer de limiter la transmission de COVID-19 et identifier les cas aussitôt que possible.
Mm-hmm. Je sais qu'aujourd'hui, vous avez annoncé ces modifications avec le dépistage, l'isolement aussi. Est-ce que la Provence prévoit de mettre en place d'autres mesures? Cette semaine, on sait qu'il va y avoir le passeport vaccinal. Qu'est-ce que vous pouvez nous dire pour les prochains pas qui seront donnés par la Provence pour assurer qu'on sera en sécurité dans cette 4e vague?
OK, si j'ai compris, on a beaucoup de mesures vraiment en place. Vous avez mentionné le passeport vaccinal qui va commencer semaine prochaine et puis on va avoir plus de détails plus tard cette semaine. Et puis on a le vaccination ou test pour certains gens qui travaillent avec les personnes qui ne peuvent pas être vaccinées ou qui sont plus vulnérables aux effets de COVID-19. Et puis, on a des tests pour les enfants dans les régions Est et Ouest. On a toutes sortes de ces mesures ensemble qui vont essayer de nous protéger quand on entre dans cette 4e vague. Et c'est juste un moment qu'on ne veut pas vraiment penser de COVID-19, mais il faut qu'on y pense pendant quelques mois, je pense, mais de s'assurer qu'on a le moins d'impact ici que possible.
Excellent. Merci beaucoup. Bonne journée.
Bonne journée.